Okay. Can you see and hear me now?
Yep, we can.
Okay. So the first thing that I'd like to go over, especially when it comes to Zoom interviewing, a lot of people mess up some low-hanging fruit from how to come off with a good impression. So if I'm sitting here, I want to show you one of the common camera angles that people use, Mohammed, and I want you to critique it. So if I were to put the camera like this, how do you feel about this?
I think it's very close.
Mm-hmm.
You are very, very close to the camera. So maybe a little bit of distance, just like in real life, we don't put our faces very close together.
So what's the significance of it being close? What do you feel emotionally that I'm sitting this close to you right now?
Some bit of intrusion or invasion for privacy.
Okay, I like that you use the word invasion, because
Yeah.
when you think about it from an evolutionary biology perspective, there's really only two times that a mammal is going to see another mammal this close. Well, maybe I'll say a primate, a human. And we only really get close to each other's faces if we're going to kiss each other or kill each other. So either way, when your brain perceives me like this subconsciously, you are receiving a bit of a threat. It's a bit of an intrusion. And so subconsciously what's going on is it's affecting the impression because you're a bit too close. And then there's, of course, all of the objective stuff, where if you're right here, you can see every pore on my face. If you're right here, you can see my brain, and nobody wants to see that. So this is the first angle that doesn't work. Second one is, let's say I do something that people commonly do, is something like this. We'll just prop it up on whatever's there, and it'll look something like this. And then I'm going to lower the desk. Right here. So a common one is something like this, with the hands here. What do you think about this one?
I think it's not an interview view, let's say. It's more of lecturing somebody, because you are looking down on them more than looking at the same level. This is for first.
Brilliant. So there's a lot of folks will have it be straight across or sort of it's still a little bit down because they're using a laptop. So if I'm looking down at my laptop and my hands are perfect ergonomic height for typing somewhere down here, number one, there's still that sense of maybe not as intimidating, but it still doesn't look like me talking at an equal or someone who's applying to me. The other thing that is really rough here is that right now I'm doing all sorts of things with my hands. It making me look really smart, but you have no idea. So when I go from here to here and I start talking like this, how does your impression of me change?
It gives more depth to the talk you are giving, and I can understand more, because body language is very important, not just the words you are saying.
You can understand more.
Yep.
So exactly the context of what I'm saying, the emotional tone I'm conveying, how I'm reacting to you, they're all coming across with hands. But I'm sitting over here getting a tricep workout because my camera's at the wrong angle. So I watched the YouTube video, said, show your hands. So I've shown my hands, but now every minute that progresses, I'm becoming more stressed out because my muscle tone is high. Okay, so I'm going to go back to the main computer and we're going to look at an angle that really works. Let me do this. Okay, can you hear and see me okay?
Yep.
All right, so I'm going to put this computer down. You're going to see sort of the angle that I advise. So we're going to incorporate the insights that we had from all of those different angles. So from when it was too close, we were feeling intruded upon. We were feeling that sense of invasion, that sense of threat. When it was not too close, but at the wrong angle, you weren't seeing my hands and you weren't getting a full sense of me. So what I'm going to do, I'm going to put my cardioid microphone here, and we'll talk about what that means in a second. But we're going to sit a little bit further back than I normally would. And with standard US business practice, if you're sitting, you undo the button. If you're standing, the first button is done. So I'm sitting back here. Now in this perspective, Salahuddin, you're on camera now. Tell me what the features of this angle are that make it work so well.
I think like because we can see your entire arm, so you can use them more to convey words in a way. But I think you're showing like your legs and like the end of a hair. So that's a bit off. Not really sure.
Well, so there's something about showing my legs. At least to me, it says maybe the last guy was wearing shorts, but I'm wearing pants, right? Because in the age of Zoom, you don't know. When you see my whole trunk, so when I shift towards you, if I'm here and I sit here versus I shift towards you, you don't get much of a sense. But if I'm here, this is intensity. This is enthusiasm. This is withdrawal. There's more nuance because you can see the entire trunk. Now, are these pants the right size for me? Maybe not. But, alhamdulillah, residency is expensive in the US. So, like, take it easy on me. But so that's one thing, is you're getting the full scope of the body language. The other thing that you're getting, as Muhammad said, is that we're slightly above eye level. So my camera is about an inch above my head. So you're looking down on me a little bit. How does that make you feel?
Maybe more relaxed or comfortable. Like I'm not looking up to you. I'm just looking at the same level or a little bit down. So just like in real life.
Right.
It could be perceived as like being friendlier, the one you're talking to.
Yeah. Because when you're looking at someone who's shorter than you, usually it's in a position where you are physically, evolutionary biology, you're physically dominant, you're there to help and support them. So help and support is evoked. Or you're looking at a child, so there's no threat there, right? So everything in your brain is relaxed. Just because I'm a little bit lower, and then I'm a little bit further back, so I'm not invading your space, and you can see everything about my gesticulation. So I had a client last night, we were doing interview prep, and I asked her, and what she said was, I seemed more intelligent, which you could see my hands, because I don't seem like I'm, just dragging my knuckles over here, right? Because this right here, me doing this, I'm doing it here. But if I start gesticulating and doing all of these things that look great, I look exactly the same as the guy who's dragging his knuckles on the floor until I'm visible here. Is that clear?
Yep, it is.
Okay. A couple of other things I'll show you before we get into the actual prep. This microphone, it cost $140 when I was applying to residency. So it was all virtual. So I said, I don't have any flights. I'm going to buy a nice microphone. This microphone is directional. So right now, my voice sounds like this. How does it sound now?
Distant.
It's in the same spot. I just turned it a little bit.
Okay.
How does it sound now?
Better.
No, better, yep.
Yeah. So many microphones, people don't realize, are directional. So this thing is right now on cardioid, which tends to produce the best recording, but it's directional. If I'm going to have it not facing me and I want a good recording, as you can hear now, it's probably a little bit distant. I'm going to switch it over here to circular. And here, it should sound pretty much as good as it was on cardioid, right?
Yep, it does.
Okay. So I'm going to leave it on this setting. But so be mindful, you can do some recordings and test what your microphone does, but make sure that even if you have a really good microphone, that you're actually using it correctly. The third thing is your background. So in this case, there's several things that I'm doing wrong. Can you pick up on things about my background that I should change?
I think there is a lot of things in your background, for example, laptops, bags, etc. So maybe to hide your background or blur it a little bit, or just remove these things.
So many people think that you have to have a clear background, that nothing is there. You don't have to have nothing there, but everything you put is deliberate. So in this case, it doesn't look deliberate because I have this old thing I'm trying to sell from a long time ago. I've got these two cases of musical instruments when I added that. And then over here, I have a case with the Quran in it, and I have my medical degrees. So what am I trying to do here? So I offend half the people with this one, offend the other half the people with this one. Who's going to start a conversation? Right? So if you want to put something in your background, plants are never offensive. Your medical degree is never offensive. Any other degrees you have are never offensive. These are these two. Because of the camera angle I have right now, you can't see, but I have some books over there.
Okay.
If I wasn't so frugal, I would probably have some things on the wall, and that's okay. But just keep in mind that anything you put there, you want it to be deliberate. If it draws their attention, you don't want to be, oh, man, they're not paying attention to me now. Like I distracted them. Now we're wasting time on this. It's like, oh, good. They noticed that I have such and such, and they're asking me about it. Like they notice I have, perfume bottles, and now they can talk about my interest in making perfumes. Does that make sense?
Yes, it does.
Okay, last thing. The last thing about your setup, where should the light source be?
I think it should definitely be in front of you and like warmer, not lighter.
Yeah. So in this case, I pulled, let me see how to get this on. Okay. I have this. This is a new one, so I still don't exactly know. Let's see. Here's warmer. So I do this. Now it looks like I am doing my interview from a tanning bed.
Mm-hmm.
So ideally, I wouldn't do that. Let's see. We can mix in. We can do a mix of lights here. So that was pure sort of reddish light. Now I've mixed in the red and the white to make it emulate sunlight a little bit better. This is $13 on Amazon. How's this look?
Yeah, it's much better. But like, would you think that like actual sunlight is better than other lights?
Actual sunlight is the best, period. Which means that your computer, your camera should be in front of the window. So it's window, computer, you. People sometimes do it the other way, where the window's in the background, or as in your case, you have the lamp on the ceiling. So I just see these streaks of light up here, rather than seeing this incandescent, everything's the same color. That's something else. If I turn this on, you can also see the effect of, if you have a directional light source that is not in front of you, you can sort of see it creates shadows. So you want to avoid that as much as possible. But that of all, so everything I've spoken about so far was in order of importance. So the camera angle first, making sure that your hands are seen, the background second, the lighting, most people will do without any ambient light source here. But if you do have lighting, that's how to think about it. All right. Questions about that part before we get into the interview prep?
Dr. Adam, regarding the uniform that I should be wearing, for example, for an interview, should I wear a tie and a jacket or blazer, or just
100%.
Okay. Okay.
So you can think of it in terms of, why is the meet window so small? Where is, okay, there we go. There we go. Okay, let me just put this here. I'll answer that question while showing you another thing, which is that a lot of people will put their zoom down here or down here, but then you think you're looking at the interviewer, but you're not. Make it small, even if you can't, if you don't have them blown up, and put it right under your camera. Now it looks like I'm making eye contact, right?
Yep.
Okay. So to your question, what should you wear? The principle is, who are you going to offend with your choice? So if you have if you're dressed in a suit and you're in front of the most conservative, strict, businessy interviewer, He's happy. If you're in front of the most liberal, do what you want, doesn't matter what you dress, chill out type interviewer, they're also happy. They're not upset that you're wearing a suit and tie. But if you liberalize a bit and you're wearing, you're unbuttoned, you're not wearing a tie, you don't have your blazer on, or you're showing up in, shorts, or maybe that liberal person's going to vibe with you, like, yeah, man, that's awesome. You're such a chill. But the conservative person is going to be thinking, really, that's how much you care about the interview? Like, so you've upset them. Let's see. I don't know why it's off center. That's fine. Does that make sense?
Yep, it does. Thank you, doctor.
Okay. I had a bunch of stuff prepared, but it's only two of you. So we can just answer whatever questions you have. We can prioritize it that way.
Okay.
So what are the priorities on your mind that you'd like me to address with you?
I think for an interview, because it became online recently after COVID, we covered the most important part just to make it as much as in person.
Mm-hmm.
So that was the most important part that I wanted to ask about.
Great.
But regarding the interview itself, I saw your stories yesterday. They were great.
Thank you.
I wanted to ask about the phrase, tell me about yourself. In your story, you mentioned some tips how to tell them about yourself, but can we expand more on that?
Yeah, which one of you is going to practice?
Salah, if you want, go ahead. If you don't want, I'm ready.
I'll leave it to Muhammad.
Okay.
Yeah.
Okay, so thank you, Salahuddin, for volunteering to go next. So let's try it. So Muhammad, welcome to I don't know what's the school people like, University of Timbuktu psychiatry residency. I'm glad to have you here. So I've been here for a long time. I came here with my wife 10 years ago. It's a really great place. The people are really nice, and it's been a great place to have a family. I'm sure we'll have time to talk about my interests and all that, but I want to hear about you. Can you tell me a bit about yourself?
Okay, thank you very much, Dr. Howard, for sending this invitation. I agree with you. This is a great place. I saw some pictures on Google, and it looks great. About me, I'm a sixth-year medical student at the University of Jordan. I graduate. Oh, okay. Okay.
All right, pause.
Yep,
Awesome.
pause. Redo it. Because
why did you pause?
I graduated, but I'm used to say I'm a final year medical student. So, yep. So I'm a medical graduate. That's what I should say. I'm a medical graduate from the University of Jordan, a class of 2025. I have a strong interest in psychiatry. I entered medical school because I want to be a psychiatrist. I love playing video games and going on walks. I think that's it. I'm not prepared. Okay.
All right, Salahuddin, you're the medical admissions consultant now. Critique that. Tell him what was good first, and then tell him what you think.
I mean, looks wise, he does look professional. The lighting would be off, as you said. I mean, the lighting isn't right where I am too. So,
Habibi, leave off that stuff. Like he's not set up. I want you to
okay.
Go in on the answer.
Okay, the convo. It's good. It's general, not specific. It gives us like a general idea of who Dr. Muhammad is and like what his interests are. I like that he also went with non-professional stuff like video games or walks, because I think that would be relatable in a way.
So it was perfect in your mind. There's nothing that you would want different.
I mean, sure, yeah.
So tell him.
It is. It was perfect in my mind.
Okay,
So
thank you.
yeah,
MashaAllah, MashaAllah. Okay.
Hello. You're
So,
hired.
okay. All right. So let's analyze his response. So he started with, I'm a medical student. That's fine. The part that actually happens a lot where people say, I'm a fourth year medical student, like whatever. That's fine. And it's even a bit humanizing because you joked around a little bit with it. That's totally fine. But you say, I'm a med student, and then I have a strong interest in psychiatry, which is like, I'm really interested in psychiatry, but I'm also interested in this and this and this and this and this. You're in a psychiatry residency interview, right? So that language is too gentle. It actually backs down the intensity from the assumed level when you're there. If you just say I have a strong interest in psychiatry, and then you talked about video games, walks, and then there's a fourth thing that I'll talk about in a second. But when I say tell me about yourself, you're applying to be a psychiatrist. So are you going to describe your selfhood, your identity to me at the level of med student, interest in this subject matter, video games, walks? Because that's not you, right?
Yep, that's correct.
So that's actually a really common thing that people do is they start. So remember, you've been in the interview and they have already said, hi, Muhammad, it's nice to meet you. So they already know your name. And then they've looked at your application probably, unless it's blinded, which is a separate topic. And then you start with, I'm Muhammad and I came from this medical school. That's the first two things they know about you. So already their brain is like, I'm not getting new information. And so you've reduced the punchiness of it. But moreover, so let's see, what do you think is the alternative to starting with listing just a smorgasbord of things that you happen to be doing?
Can you repeat the question, please?
So what you did is you listed some just facts about you. What would the alternative be?
I wanted to say to list my accomplishments, but I remember that I shouldn't start with that. So
Because you follow me on Instagram, so you don't do that. Outstanding.
yeah.
So what else?
Maybe because they talked about, for example, the city they are in, I can just explain why I want to go there or why I apply there.
Does that answer my question of tell me
No.
about yourself? Okay.
No, it does not.
Dr. Adam, I have a question.
Yes.
Would complimenting the interviewer be a good start to break the ice?
Try it with me. Ask me, tell me about yourself, Salahuddin. I'm going to try that strategy.
Okay. I'm Salahuddin. Okay. And I'm applying.
No. Ask me. Ask me to tell you about myself. I'm going to try your strategy for you.
Oh, okay. Yeah, tell me about yourself.
Yeah, about the first, can I just say, what a great question that was. And what an incredible beer. I mean, subhanallah, tul al-lihya, amazing. Like, I'm just so excited to meet you.
That's a lot.
So even if I wasn't so psychotic like that, still, you say, tell me about yourself, and then I compliment you, it's fawning. So I've frozen, and it's a fear response. Fight, flight, freeze, or fawn, and I'm fawning at you. Rather than directly addressing the question. This is probably the hardest question. So we're spending a lot of time. We should be. It's okay. Everyone does. Tell me what the alternative is. If you guys come up with it, it'll be so much more powerful than if I just tell you.
maybe I can tell you about how my day started, or um, the thing that ignited the passion in psychiatry. Yeah.
That.
Okay.
Okay,
Mhm.
that is what I was hoping for. So a lot of students, they will start with, hey, my name is Steve, and I just graduated from this medical school. And then they go into accomplishment. So let's say that they're really into engineering. Say I worked in an engineering lab, and I made this thing, and I got this project, and I got this grant. And I'm sitting here as the interviewer, and I don't care. I legitimately don't care, because it's just a list of facts.
Mhm.
Right? You could be an AI program. You could be, someone I would love to have lunch with. You could be someone who's totally incompatible with me. If
Mhm.
I'm interested in engineering, great, we're connecting. And they do try to match you with people with shared interests. But if you lead with all of that stuff, you may or may not connect. So if I'm not interested in engineering, you are interested in engineering. The only way that we're going to connect, and I'm being like very specific about it, but in general, if my interests and my identity are very different than yours, the only way we're going to connect is over a shared sense of values. So maybe you pursued inquiry into the human condition via the avenue of engineering, but I expressed my curiosity in neuroscience. And this other candidate did it by learning how to coach sports. They learn everything about sports. They're interested in sports psychiatry. All of those candidates can connect with each other and with me by starting with what motivated them to pursue that direction of study.
Mhm.
Which is why on my Instagram post, it says start with why. That's the first thing, is start with why. Tell me, when I say tell me about myself, tell me about yourself. Start with your core identity. Start with your core identity, something like, it's a really great question. Tell me about yourself. If I had to define myself, I think I would start with teaching. As far back as I can remember, the thing that gave me the most joy is teaching, because it's always been something that forces me to learn really well. Because I have to understand it really well if I'm going to teach. And then it gives me a way to connect with people. I can come into a conversation with the sense of, I want to understand you really well so I can understand how to communicate with you really well. And that's shown up in all of my studies so far. So as soon as I started medical school, I was I took my course, and then I was a TA, and I was teaching. I started an Instagram page, and I'm posting what I'm learning, and it helps me learn better. And when I think about what I'm doing here, to me, psychiatry is the art of learning about people in intimate detail and teaching them how to approach a better quality of life. It's always individual, and it's about teaching. And I guess, apart from that, I would say, teaching obviously has a lot to do with having a family. I've got, a wife and 2 kids. And then, in my spare time, I mainly do a lot of athletics. I like to go outside. I enjoy reading fantasy books. Yeah, thanks for that question. How did that feel?
Human.
Human.
It gave me a clear idea about who you are without just listing accomplishments or things you have done. But at the same time, I knew what you have done.
Yeah. So I gave you, I was vulnerable. And Anas, I saw you raise your hand. I'll come to you in a moment. I gave you, I was vulnerable with you enough to actually describe my selfhood.
Mhm.
So if I do that differently, Salahuddin asked me, tell me about yourself.
Tell me about yourself.
About myself, yeah. My name is Adam. I just graduated from the University of Canada Medical School, and I wanted to do psychiatry for a really long time. I really like about the patients, and I like how the longitudinal relationships are. There's just no specialty like it. I'm really excited about it. I guess apart from that, I'm really active in lacrosse. my wife and I play lacrosse, and we like the outdoors. We're big foodies, and I know there's a lot of good food around here. But yeah, that's me in a nutshell.
Okay. I think that drifted from the topic a bit much.
But why? That's what 90% of the people who work with me, that's what they show up with doing the first time.
Hmm. Hmm?
What's wrong with it?
You didn't like explain your passion in detail. You just said that you're interested in psychiatry, and that was it, and that you're a medical graduate
Mm-hmm.
from the University of Canada, you said. But like another question I have, Dr. Adam. Do you talk about the stuff that is already on your CV during the interview?
Depends on what they ask. Why not?
Dr. Alden? Yeah.
Yeah. Okay, so just to wrap up the telling about yourself, I see you guys have other questions, but for tell me about yourself, I want you to just notice how differently you felt when I started with why, how both of you were like looking straight at me and you're like, what's he going to say next? Because I started with the thing that makes you interested in me, which is the sense of values and purpose that makes me human and that we can connect on. Then I can talk about whatever I want. When I did the opposite, you both were kind of like, how long is he going to do this for? Like, which is interesting because Salahuddin said that your answer was perfect, but that's basically what you did. So I don't want you to do that. All right, I'll answer any questions. What's next?
Okay, another question. I think on your story, Doctor, you asked about hardships or challenges. For example, if somebody failed step 2, let's say, and it came up in the interview, how or low score, for example, how can somebody manage these questions?
It's a good question. So I failed my family medicine clerkship the first time, and it came up in my interview at the place where I matched. So this can be a really good opportunity when people ask you about failure. The first thing I'll say is the most common mistake is that people will say like, okay, yeah, I failed step 2, but around that time, I had Ebola and my grandma was sick and my cat died and it was really hot outside. They're just listing all of these reasons to try to convince me why it was understandable. That's the worst thing you can do. Because the opportunity is to say, around the time that I was studying for step 2, I was dealing with quite a number of priorities. And I'll be honest with you, I knew I should be studying more, I should be studying differently, but I didn't. And the reason why I didn't was I just don't think I was able to manage it. That was the first time in my career where just a lot of things happened at the same time. I had obligations to family, finances were tight, and I was studying. And that was the thing that I let go of. Goodbye? Yeah. Assalamu alaikum. I'll see you afterwards. Okay. But as I reflect on it, there were just so many things I could have done better. So when it came to studying for step 3, a lot of the things that were going on were still going on, but I prioritized differently. I focused more on quality over quantity. I used my time more deliberately, and I was able to get a better score. So everything comes out of my head when I see my children. So they're gone, and I forgot what I was talking about. The point being, if you can name exactly what went wrong, and then name exactly what you did to get better, and then name exactly what is better because of what you changed, that is the way that you do it, rather than focusing on the experience, making excuses, talking about how hard it was, or exaggerating.
Yep. That makes sense. Yeah, and Doctor, another question about, tell me about yourself. How long should my answer be, and how to answer in a way that's not memorized? For example, I don't want to sound automated.
If you're counting how long it is, then you are going to sound automated.
Okay.
How do you know when to stop talking when we're having a conversation?
I think body language gives a big deal in this. For example, if somebody is looking away, if they are playing with their hands more, if they are just seemed bored, I will stop talking.
So if I look at my camera like this the whole time, will you keep speaking for 50 minutes?
No, because I don't have this much of talking for 50 minutes.
So it's not that they start looking disinterested, but when you're having a conversation, it's not something you think about. You just do it. You just kind of know. I think the way that you know how to, the way that my best clients, like the ones who do the best, they know what their values are, what their why is, what the core of what they have to say is. They know what they're about. So they have all of that as background knowledge, but they didn't prepare a script for anything. So if I asked them out of the blue, imagine you were in Antarctica and your only companions are a fish and a penguin, which one would you eat? There's no way to prepare for that. But if you know yourself and you'll sit there and kind of think through it, like, guys, I don't know, man, that's funny. I would laugh at it. And then I would, come up with something. So similarly with tell me about yourself, if you memorized it, when they ask a follow-up question while you're in your flow, then you freeze and like, whoa, what do I say now? But if you just know yourself and you're talking and then you say tennis and like, oh, you play tennis. Tell me more about tennis. Oh, like, oh yeah, let's talk about tennis, because you know yourself and it's just a conversation.
Yeah, that makes sense. Okay. Thank you, Doctor.
What's the next question you'd like to address?
Doctor, regarding psychiatry, it's a little bit like the dilemma questions. I think you named it in your post. So, for example, if they asked me about, let's say, a political view or a religious view, I know it's there. For example, they just want me to express myself and to see how I will manage different patients from different backgrounds, but how to tackle these questions in, let's say, in correct way without offending anyone.
There's two different types of questions you just brought up. One of them is a dilemma question, which is sort of your patient needs a blood transfusion and they're a Jehovah's Witness. What would you do? Where there's, or which patient do you give the transplant to? That type of thing. That's a dilemma question. The second type of question that you're talking about is an identity question, which is like, oh, I see here that you are, this and this identity. What if a patient comes in and they have different beliefs than you? How would you deal with that? Which one are you asking me about?
Actually, both. So maybe let's start with the second one.
The second one.
Yep.
Do you have an example, like what particularly you're worried that they might ask?
For example, I heard from somebody who matched 3 or 4 years ago in psychiatry. They asked him about the recent events in the Capitol in the US in 2021. And yeah, so for example, he managed it well, he told me, but it's a difficult question to answer, honestly.
What was the question?
They told him, I think it went something like that. Have you seen the news about the Capitol? Mm-hmm. He told them yes. They told him, what do you think about that? Just like, so yeah.
First off, I feel like if I ask that question to a candidate at my program, I would get chastised for asking that question. There was an old practice in interviewing in the US called hot buttoning. Hot buttoning. Hot buttoning is when you ask about something that is controversial, to see how the person deals with being offended. So this happened to me in my med school interviewers, in my interviews, one time. But anyway, so that practice is now less and less common. But what do you do if it happens? So if you ask me, like, what do I think about the January 6th riot in an interview, the most powerful thing you can say is, I don't know, and then show them how you think. So I legitimately don't know much about that. So if you ask me that question, you're saying, I've heard about it. You know, who hasn't heard about it? I don't honestly know that much. What I could say is, from what I do know, it seems like the conflict is between people who believe that the election was rigged and people who believe that it wasn't. Insofar as I'm not being asked to make a decision about it, I abstain. And I think the reason for that is because the less involved I am in strong political views, the easier it is for me to be neutral. And the easier I can be neutral, the more I can connect with people who have different beliefs and values in my role as a doctor. And then they would ask some other thing, and I would follow up.
Okay.
What if they ask, so if I were interviewing you and I wanted to, so what if, okay. What if they asked you, you have a patient in the emergency department who's acutely psychotic and suicidal. She is a Muslim girl, she's 25 years old, and she comes in wearing a headscarf. But she also has these scars around her neck from where she tried to hang herself during this psychotic episode. As part of the routine for admitting her to the unit, you have to remove any ligatures. And when you say you have to remove your headscarf because it's too long and it's a ligature, she refuses to take it off and starts becoming agitated. What would you do and why?
Okay. First of all, I should respect her decision, but since she is psychotic and is suicidal, she doesn't have the capacity to make such decisions. But in order for us to build a bond, and maybe I can put a close monitor on her one-to-one, for example, and keep her headscarf on. But if that's not possible, I'll just take it off because it possesses direct harm on the patient.
So that was a good answer, because you came at it with like, all right, well, let me be thoughtful about it. This is an importantly held belief to this person, but being not dead is also an importantly held belief. And right now those two are at odds. So I need to take this away. I'll try to accommodate if I can with the resources I have, but if I don't, the priority has to be to keep them alive. And so I would take it away. That was a great way to think through it. The wrong answer would be like, no, bro, you can't take it away. It's a Muslim woman. It's her headscarf. Like, how can you even ask that question? Is it because I'm Muslim? Would you ask me that if I was white? So that candidate just got hot buttoned because they asked about something controversial and you lost your crap.
Yep.
In fact, that's a situation that actually happened to me in the ED. And one of my friends and I, we did a quality improvement project that we managed to get these ligature-free headscarves, these paper scrub headscarves that Muslim women can wear if they can't have their ligatures. So like this stuff happens, but I guess summarily, try not to get triggered, try not to get defensive, come at it from a place of curiosity and wanting to connect, and wanting to think through something together and to incorporate shared values.
Yep.
There's another nuance here, though, that a lot of the clients I've had, they will say, the big reason I want to become a doctor is because of, my Christian values, and I want to live out my Christian faith in medicine. How do I talk about that? And it goes back to what we were talking about with tell me about yourself, which is if you focus too much about the what. So if you're talking about, scripture this and this, ideology that and this rule that, you're building a wall where you're on one side, I'm on the other side, and I get to choose whether or not to, I get to choose how to engage. But if you start with, my faith tells me that protecting life is sacred. And, for me, my whole purpose in life is to live by the values of my faith. And being a doctor, it allows me to live that out. The value of compassion, the value of caring, the value of preserving life. So all of these things are with me every day. And then they'll say, well, there's patients who don't believe in what you believe. How are you going to deal with it? And then you say something like, it's not about them believing what I believe. A lot of my morals, the things that make me an effective clinician, come from that. I can bring those shared values, those shared wants, the work ethic and the passion for service into any room. And the patient can bring their values too. And I think what's important to me is to connect with them and show a non-judgmental stance, trying to connect on the human values that make us similar, rather than the exact terminology that separates us. You communicate that sentiment. Does that answer your question?
Yep, it does. So I think being as much as neutral as you can and just find some common ground between you and the interviewer and just explain the why and how you are thinking about it, the process of thinking. I think that
the process of thinking is always the core thing, and that shared why. Those are the two elements that are big.
Perfect. And okay, so the first question about the dilemma questions, how to manage these questions.
Let me see.
I think we covered that by talking about for example, the headscarf thing, or it's different?
It's different. Let me see. Let me see if I open this. Okay. So I'm just going to share this. Okay. So this is a bit messy, but I'm going to talk you through it. So you've finished medical school, so you guys know how to assess thought process, right?
Yes.
Okay. What kind of thought process have I drawn out here?
Linear.
Okay, brilliant. So when it comes to a dilemma question, most of the issues that comes is that someone gets very circumstantial. So you start talking around the issue, you start talking around the question. When you get a dilemma question, what I recommend that you do is start by grounding yourself in point A. So if I say something like, you have a 72-year-old priest and a 22-year-old criminal, and they're both in kidney failure and they need a new kidney, which one would you give a transplant? There's a lot of stuff in that question that's weird. But anyway, it allows you to think about the first thing that you need to do is give a restatement. So you can say something like, what's my voice is going here? I'll use my ASMR voice now because my other voice is gone. I'm a whisper. So you would start with, my understanding of the prompt is that there's two patients, both in kidney failure. One is old, one is young. One is just out of prison, the other one works as a priest, and my job is to decide who gets the kidney.
Yeah.
See, you guys were supposed to do most of the talking. See what you did to me. Okay. So now that you've done that, you can move on to naming the dialectic, which means both things are true. So on the one hand, there's somebody who's a priest, which I assume means they have good family supports, they good financial supports, so they would be able to get good follow-up care when they get the kidney, which is really important. On the other hand, the other patient, even though he's just out of prison, he's young and presumably is a bit healthier, so might be able to tolerate the procedure better. But the downside there is if he just got out of prison, he may or may not have the financial and social support to take care of a transplanted organ. So first, I restated what the prompt was, and now I've said there's two sides to this question, this and this. Something very clear. Next, the way I would think about it is, and then you say it. So would you engage the transplant committee, or would you need to do an assessment? Would you say, well, it's not my area of expertise, but if I were on a desert island and I had to make this choice on my own, I would try to find some sort of objective or quantitative way to integrate all the different variables of each patient and see which patient would likely get the most increase in life expectancy or quality based on the transplant. And I would try to be as objective as possible. And then you stop. So you see here, the step is stop, which means like, shut up and stop rambling, because here you're going to go tangential. They may have a follow-up question for you. If they don't, they might move on. Now, the reason why the restatement at the beginning is so important, because I want you to imagine that if I got this wrong, they could correct me. And then it gives me another chance to get it right, which I wouldn't have if I didn't restate.
Yes.
But maybe they don't correct me. And I say, okay, my understanding is that I have to decide which of these kidney failure patients get a blood transfusion. Like, why would you think that? I don't know. But then I go through a really rational and reasonable approach to how I would make that decision. They might interpret that really well anyway and say like, oh, actually I asked this, but I got the same information I needed. Like, that was a really good thought process. Which if you didn't restate, and if you just went into it and started doing this, you would look like an idiot because they don't know what question you're answering. Was that helpful?
Yes, it was very helpful.
Okay.
So just so I can make sure I get the point. So I won't give a specific answer to their question. I will just compare the both sides and tell them the process I'm having.
No, at the end of it, you give your answer.
Okay.
So thank you. I wasn't clear enough about that. At the end of it, when you've restated and you've given the dialectic, and then you've spoken through your thought process, you say, and based on that, I would do this with the information available to me.
Oh.
And a common way that this goes is that they'll do that, and then they'll give you some new information. Like, well, what if this were the case?
Mm-hmm. And
in that case, it's important not to anchor and say, no, I'm just going to do this. No. Listen, maybe you say, well, that information is valuable, but I think on the whole, the calculation remains the same, so I'd stick with it. Versus saying, oh, I didn't know that. So I didn't realize that such and such law is in effect, or such and such thing about a patient affects her eligibility. So yeah, well, now that I know that, I think I would make the opposite choice. You're just showing your flexibility.
Yep. Doctor, is there any question that I can refuse to answer without affecting the interview? For example, if they asked about, let's say, a personal thing.
You can refuse to answer whatever you want, I guess. So an interview fundamentally is a conversation.
Yep.
So you can do whatever you want, but just understand that whatever you're doing is impacting the process of that conversation.
Yes.
So if you ask me something and I say, no, I'm not going to answer that, and then I'm silent, that's weird. But if you say, it's a good question, but honestly, that is such an intimate topic for me. I'm not sure how to communicate about it in this space. If it's all right with you, I'd prefer not to answer it.
Yeah, that's very different from the very first answer.
Yeah. So it just depends on how you do it.
Yep. Okay. Mahdi, hi. I see you are here with us.
Hi, Kifadic.
Hi. So we are
Remember that
just
from last time.
exactly.
Good to see you.
I see you too.
Well, then we're about at time, but if there's any questions from anybody, I'm glad to answer them before we wrap up.
I think one last question from me, if your time allows.
Mhm.
If they ask me at the end of the interview, do you have any questions? Should I ask, for example, about the environment of the residency program, or how many hours I will be working, etc.? Or will that be better answered by the residents themselves?
That's a great question. So the last slide of the reel that I posted last night, follow me on Instagram at Dr. Adam Howard. Anyway, when they ask you that, it is advisable that you have something intelligent to ask about. So if you have specific interests that you wonder if it's something you can pursue there, or there's a particular opportunity, you wonder if it's still there or how people get into that, you can ask about that. You can ask about the area. What's it like living there? Showing that you're really visualizing yourself there and weighing the pros and cons. Shows that you're you're very much thinking about it. You can ask the interviewer like why they came. You can be curious about their career. At least when I interviewed, I was so excited to be meeting these people who I would never meet, like these incredible physicians. So I had, that was one way that I can connect with them, is just be curious, be excited. I don't advise you to say, I don't have any questions, because that, all my questions were answered. If that's the last interview of the day and they have been answered, that's kind of reasonable. But if it's your first interview of the day and you don't have any questions, something's up. For things like hours and all of this and the logistics, most residency programs will actually present that to you at the start of the day. Someone will give you a PowerPoint and explain about that. You will, at some places, have a pre-interview dinner or a pre-interview Zoom call or whatever, or post-interview get together with residents. And the nitty-gritty details about logistics, sometimes that is a better space, because otherwise, because the residents will know it better than your senior faculty asking like exactly how many weekends am I on call. They may not know, but those are all good questions. Where you put them. If you are interviewed by a resident, that's a good interview to ask that type of question too. All of that being said, don't ask anything that you could Google. So if it's on their webpage and you're asking about it, at least to me, that looks lazy. And don't ask questions that you don't care about, because it's fairly obvious. Yeah.
Okay.
Does that answer it?
Yep, it does.
Good.
Okay. Salah and Mahdi, if you have any questions, go ahead.
I don't have any. Everything was good. Thank you.
Pleasure.
I do have one question actually.
Uh-huh.
So when it comes to like interviews, like are there any red flags we should look for in the interview itself? Like for example, a style of question or something that they would ask that would tell us that's about a program to rank.
You can ask 5 different people this question and you get 5 different responses. You're saying if they ask you this question, then it's a red flag?
Yeah, exactly.
If they're asking things like, do you plan to take paternity leave? If they're asking things like, hey, are you going to need breaks to do prayers? Or, stuff like that, that's really intrusive. That's sort of seeming like because they should not be asking about these elements that are protected. They can't discriminate based on race and religion and these types of things. So if they're asking you about that in a way that feels wrong, then maybe that's wrong.
Is the capital thing like considered also like a red flag? The one we talked about, the 2021 events, the riots.
That's more of a gray area. So for me, if you ask me that question, I'm fine with it. I don't care. I feel like it's pertinent to see how the candidate deals with controversy, because you'll have a patient who will come in and be celebrating the election result that you were miserable about. So finding out whether or not the person is able to be professional enough to hold it together and do what the patient needs regardless of their beliefs, I think that's fair game. I also, I know other people who, if the interviewer is even slightly odd or asks a bit too much about this or whatever, then they feel like, oh, red flag, I'm not going there. So it is a bit individual to you in those types of areas where they're not clearly trying to discriminate, but they're a little bit instigating. You're like, is the culture somewhere I want to be where that's the type of question they ask?
Any follow-up questions? Because I think our time is up.
My closing comment is follow me on Instagram. And if there's anything useful that I post or something that you like it, please comment, please share it. As I think I said last time, the whole medical pipeline has a way of effacing people's individuality and humanity. And people come into it with their ideals and their personality, and they're genuine, they're authentic, and then they start fearing rejection and fearing being misjudged and being flooded with all of these ideas that are not based in reality about what you have to do to be a doctor. And people are suffering because of that. So I do what I do because I want to change that. So if anything that I've said to you today is valuable and you think is going to help you show up as your best self in your career, please follow me where I'm online, share it. And if you have any questions, send them along, just DM me on Instagram at Dr. Adam Howard, like full Dr. Adam Howard, at Dr. Adam Howard. DM me, I'll respond. Maybe I'll even make a video in response. If you are looking for more individualized support, interview prep, my Stan store is in the bio. You can, hire me for however much time you want. And if you ever have other events that you think I can add value to, please reach out.
Thank you very much, Dr. Adam. Honored to have you in this interview. So thank you very much. And thank you, everybody.
It's been a pleasure. Thank you.